Radiant Life Technologies. In this introductory video, I am going to explain some of the important aspects of the delta laser and what you should be familiar with before using your delta. Here is the delta laser in its case. This is the hand device that controls the various functions. This is the medical terminal, the aesthetic terminal, the meridian terminal, the probe terminal with normal sheath attached, as well as the extended sheath. This is the power supply and the power cord. To attach a terminal to the hand device, insert the terminal into the port so that the small USB connectors meet and slide in smoothly. Do not force the connections. To release a terminal, simply press on the release button and separate the handset from the terminal. The delta laser comes with operating instructions showing the detailed steps for use. Also, every set comes with a very comprehensive user guide. The user guide contains all of this detailed information on how to use your delta laser, as well as over 200 treatments for different conditions. These conditions are listed in the comprehensive index at the front of the guide. The list of medical conditions and treatments contained in the user guide does not mean that these are the only conditions that can be treated by using coMra-Therapy. Practitioners are encouraged to become familiar with the basics of coMra-Therapy and then to use this knowledge to build up your own approaches in the treatment of a wider variety of conditions. In response to growing demand, new treatments are also being developed, compiled, and added on an ongoing basis. So to ensure that you get the optimum value from coMra-Therapy, you should regularly check the Radiant Life Technologies website for the latest additions and amendments to the user guide. During treatments with the delta laser, it is vital that the terminals are placed directly onto the skin. The only exceptions to this are in the case of open wounds or where this is expressly stated in the user guide. Treatments should not be carried out through any type of clothing or covering. Clothing or bandages will affect the radiances. But when it comes to treating animals and birds, it is not necessary either to shave the animal or to pluck the bird before treatment. Since fur and feathers form part of animals and birds, they act as conductors of the radiances rather than inhibiting them. Also, because animals and birds are far more responsive to the radiances than are human beings, even when animals have a lot of hair, they demonstrate very good results as a result of the radiances that penetrate through to the skin. The same principle applies when the meridian terminal is being used to treat human hair or the scalp. Live hair does not inhibit the radiances, but instead helps to conduct them. So, apart from live hair and feathers, to avoid inhibiting the effectiveness of the delta, it is not advisable to place any form of protective layer over the terminals before using them. The one exception to this is where it is necessary to place a protective cover over the terminal for hygiene purposes. In these cases, use only a very thin and totally clear, transparent plastic cling wrap, stretched tight across the surface of the terminal so as not to form creases or wrinkles. When you are treating the hands or neck area, all rings and jewelry must be removed prior to treatment, as the jewelry will distort, reflect, and refract the radiances. The terminals should always be kept clean, and especially in a clinical setting. Cleaning the terminals is simple and straightforward. The medical terminal, the aesthetic terminal, and the sheaths of the probe terminal should be cleaned by dipping a cotton swab into colloidal silver or alcohol and then wiping the surfaces carefully and thoroughly, taking care not to scratch the sheaths of the probe terminal or to get liquid inside the terminals. If the probe terminal has been used for anal or vaginal insertions, the sheath of the probe should first be washed thoroughly on the outside with warm, soapy water. If water gets inside the sheath, this should also be dried, as the water will distort the radiances. After drying, sterilize the sheaths following the same procedure. The meridian terminal is best sterilized by holding it with the bristles facing down and tilted slightly to one side. Then, wash the bristles with a small brush dipped in colloidal silver or alcohol. Again, take care not to allow any liquid to get inside the terminal. After cleaning, place the terminal, bristles down, on a piece of clean paper towel and allow it to dry. What makes the delta so versatile is that you can alter the frequencies at which the radiances are operating. The user guide will tell you what frequency you should be using in any particular treatment, as well as for how long you should be treating each point. It is useful to understand in general terms, though, how the frequencies relate to each of the conditions. 5 Hz is the frequency used for deep penetration, as in treating the internal organs and skeletal structure of the body, as well as treating internal tumors. 5 Hz is not recommended to be used on the brain. Most treatments for the brain take place at 50 Hz or sometimes at 1000 Hz. But whenever a treatment involves scanning, there is no problem with using 5 Hz, since the terminal is not being held static for any length of time. 50 Hz is the frequency used for treating most muscle disorders and injuries and ailments that are close to the surface of the skin. Exceptions to this are given in the various treatments listed in the user guide. This frequency is also used for tumors that are located directly beneath the skin. 1000 Hz is the least penetrating of the frequencies, and this is used mostly for treating skin disorders and very sensitive skin, for example in burns, open wounds, and superficial ulcers. It is also used for treating the inside of the mouth, nose, ears, vagina, anus, as well as for treating the central nervous system. Variable frequency, which varies rapidly between 5 Hz, 50 Hz, and 1000 Hz, is used mostly for joints and bone fractures, and also in cases where it is desirable to treat a particular area at various depths of penetration. coMra-Therapy's effects are to support the body in carrying out its own healing in a number of different ways. These ways are safe and also non-invasive. It is important to understand this in connection with treating serious and chronic illnesses. When there has been a prolonged serious illness or chronic illness, the body, over a period of time, becomes exhausted and depleted in the constant fight against the disease. If the illness continues, the body eventually becomes so weak that it will use its remaining reserves for maintaining only those organs and bodily functions that are vital to the preservation of life. Consequently, if a body has become very depleted, it will, once laser treatment is commenced, first use this support to build up its strength and its depleted reserves. The result of this additional strength is an immediate feeling of well-being. After the body has built up sufficient strength, it will start to use its reserves now to initiate the healing process. But if, because of the serious illness, the body is still depleted and has not built up sufficient reserves, it will not be able to complete the healing process. The result of this is what can appear to be a relapse. If the illness has been very severe, such relapses can occasionally precipitate a state of health in which the symptoms displayed are worse than before the treatment was commenced. This state of health, however, will only be temporary, and the treatment should not be suspended. The reason why it is important to continue the treatments is because the body will once again use the support given to it by coMra-Therapy to build up its strength. This will enable it to continue the healing process. As the body heals, the patient will start to feel stronger and better. But if the illness has been very serious or prolonged, the body will not have sufficient strength, and this may result in further depletion and other apparent relapses. This cycle of feeling better and having a relapse will continue for as long as it takes the body to recover fully from its initial exhaustion and depletion. But if relapses do occur, it will be noticed that the relapses are progressively less severe. As the body builds up its strength, any relapses will be fewer, and the intervals between these will become longer until a full recovery has been achieved. In recognition of this support needed by the body in healing itself, several of the treatments in the user guide stipulate that rest periods between courses of treatment should not be taken until definite improvement has been achieved. In all other cases, it should be noted that the rest periods serve a purpose, and that the effects of the irradiation will continue to function even during the periods of rest. However, for maximum effectiveness, no period of rest should last beyond the time stipulated in the treatment. Remember, these cycles do not apply in cases of physical pain and injuries, or when debilitating diseases are treated at an early stage with coMra-Therapy. coMra-Therapy's mechanisms of action are many, and they affect the body in a number of different ways to stimulate and support the healing process. It is this support that makes coMra-Therapy so useful in the treatment of a wide variety of diseases, illness, and traumatic injuries. This also means that coMra-Therapy's benefits extend beyond illness and encompass recovery from many circumstances in which the body has become stressed or depleted, whether from disease or from accidents, from trauma or surgical operations. In addition to recovery, though, the lives of so many people are causing them increasing levels of stress. These stress levels, together with the wear and tear of aging, as well as unhealthy patterns of living, are bringing about increased instances of chronic health-related complaints and illnesses. coMra-Therapy acts to reduce the debilitating effects of these factors on the body. Because of the effects of a person's stress and lifestyle on their long-term health, many treatments for recurrent illnesses specify additional treatments at periodic intervals. It is important that these are observed as a preventive measure, so that the effects of individual lifestyles can be mitigated and do not again lead to a recurrence of the illness. These factors also mean that coMra-Therapy has a continuing role in maintaining vitality and the body's overall strength and well-being. As a result, many people are finding coMra-Therapy particularly valuable in their search for a better quality of health, from sportsmen and women seeking to recover faster, to office workers coping with a sedentary lifestyle, to elderly people wanting to find relief from age-related deterioration. Low-level laser therapy is recognized as being extremely safe, as well as being non-invasive. coMra-Therapy is likewise safe and non-invasive. However, as with any medical device, there are some basic precautions that need to be followed, as well as some contraindications. These are listed on the Radiant Life Technologies website, as well as in the operating instructions that accompany each delta. You should be sure to read these carefully before you commence treatments with coMra-Therapy. We wish you good health, much joy, and happiness in your journey with coMra-Therapy and the Delta laser.